Now, what is a tongue tie? So the tongue has a small tissue underneath it which helps the tongue get attached to the base of the mouth or the floor of the mouth. Now, in a child which has a tongue tie, this tissue is either tight or shortened, and that restricts the movement of the tongue. So when we talk about the movement of the tongue, most of them think that a tongue that is sticking out doesn't have a tie. But when you look at a tie, there are various types of tie. Only certain types of tie that causes a restriction with the tongue to be able to move out and in. But in certain types of tie, the tongue will be able to move outside. The tongue can stick out of the mouth beyond the front teeth and then go back, or beyond the jaw and go back. But still can be restricted because certain types of tie which is much back and not be able to visible for a normal eye doesn't allow the tongue to move up the jaw. So to establish breastfeeding, it's a vacuum suction process that happens inside the mouth. So for this process to happen, the tongue will have to move up the palate and create a suction to excavate milk from the breast. Now, this is a major misconception that a lot of people think that when the tongue sticks out, it's not a tie. It needs an expert evaluation to see if the tongue, even though the tongue sticks out and the mother and child have difficulty in establishing, we need a complete evaluation of the tongue range of movements to see if it's a hidden tie or a tie that is not visible for the normal eyes.